For me, I think it's not that difficult just to answer that question. The SRS represented to me like a lighthouse that guided my professional career. I'm very proud of being able to take part in this society for many years, and I wouldn't understand my professional life without the existence of this society.
Carlos, any additional thought?
Well, I think that SRS is, without any doubt, the leader society, and it's a good reference, I think, for everybody dealing with deformities of the spine. There is not other better option than SRS.
Just tell me a little bit about the network, the people you were just meeting there, and what was you feeling when you were coming back to Spain, traveling after the SRS?
Difficult to give a comprehensive answer. My experience is that anytime I was attending this meeting, I had the chance just to hang out with friends, just to receive the best information on spinal deformities, and just to receive the sufficient input just to continue my professional practice throughout the years. And this experience was repeated every year, and that's the reason why I started attending that meeting since 1987 and until nowadays. So I'm very proud of it.
Enrique.
Well, for me the most important SRS meeting was in Orlando in 1984. My first time I attended this meeting thanks to my mentor, Dr. Valderrama. I met with the president, Dr. Valderrama introduced me to the president of the SRS, Professor Bradford. I met with other well-known SRS members as Robert Winter, Clyde Nash, and others. And I heard first time Dr. Jean Dubusset present the CD instrumentation. It was a very amazing instrumentation to correct deformities.
Joan, you have always commented on the seriousness of the SRS annual meeting content, how critical the SRS audience is regarding innovation, and how strict they are regarding the evaluation of outcomes. And you always tell me that you had like a good remembering of a special meeting. Please tell us.
Well, I was always surprised because in the SRS meetings, there are no friends between the audience and the presenters. I remember one ugly argumentation between Alf Nagenson and Bob Winter some years ago, because someone is presenting the first CD results, and Alf Nagenson stand up claiming that surgeons are using childs as pigs for experimentation. And then Bob Winter stand up and face Alf Nagenson. And I remember that Bob Winter argued that nobody has proved the parachute paradigm. There is no randomized controlled trial on efficacy of parachutes. And but I think that some years ago that probably Alf Nagenson had some reasons and are not completely wrong. But this is a very constant on the SRS, that nobody is friend of nobody, and this is very good for the audience.
But it was a matter of aging. They changed because they were getting older, and they changed their minds. Yeah.
But it's true that science is first and
think so.
evidence is first, right?
I think so, yeah.
Going back to the conversations we had this morning, you have had a long experience in scoliosis surgery, and you were mentioning that some of the surgical techniques and treatments, some of them had been abandoned and should have been returned. And you especially, Paco, mentioned one of them. Could you comment on this?
I think that we as spine surgeons, we have been affected by the new trends that came up in the market. And one of these was just to abandon the anterior approach. And I think that the anterior approach, especially for very difficult cases, has a role to play nowadays. Because I think that by doing this front and back surgeries that they used to be named, the surgery can be safer for the patients in the long run and less risky, and with optimal results. Now, because the trend is just to do everything from posterior, I think that in many surgeons have abandoned not only the practice but the idea of going anterior to treat these specific or very difficult cases. This is the feeling I got.
Yeah.
Any other comment? Any other?
Yeah,
No,
I think one thing. I think that I realized that on the improvement that pedicle screw represent and all the improvement that intraoperative CT and navigation represents, but I think that the young surgeons should learn about sublaminar wires and hooks and all this old stuff, because in some settings it's very very important, because it can help the surgeon to overcome some difficult situations. I think that there are many hospitals in the world that do not have CT, do not have navigation systems. So this is for rich countries, and I think that the sublaminar wires or sublaminar fiber wires, as you want, should still be learned to young surgeons. Yeah.
Anterior approach, or said Juan, the useful of the wires in some cases you can introduce a screw because the pedicle is too small or too tight, and in this case you can use very well a wire. It can be very useful.
What surprised me a lot is that in cases that it is impossible under an anatomical point of view just to put a screw into the vertebra. So the young surgeons have been trained only using screws. They do not have the experience of the skills just to use old devices like hooks that may help you a lot in such cases, or even wires or bands. But I think that for me it's important that the surgeons have an open mind. They don't care of using in specific cases old-fashioned tools.
Es lo que dice aquest matí. I would like to support the Paco's talk, because I think that we are ready to perform posterior release to deal with deformities. but we forgot the anterior release, which is quite important if we want to achieve harmonious reduction of a deformity. Otherwise, we are creating abnormal sagittal profile, doing extensive resection, or with a local pedicle subtraction or like that. That means brutal localized lordosis, but it's not a normal sagittal profile at all. So I think there is a place for anterior release, doing an anterior approach, obviously, and I think there is a place for that approach.
Another question for you guys. You clearly were the pioneers in third generation instrumentations in our country, basically with CD and Isola. And I just jumped in during that period of time as resident. And you were mentioning that this was really an enormous change in your practice and that this would change the life of scoliotic patients. You experienced that change, and now you follow the patients for 30, 25 years. So my question to you is, what did the introduction of third generation instrumentation represent for you? What did you learn with them? And finally, were your dreams achieved? Did the outcomes expected were accomplished? So who wants to get started with that?
When the CD came up in the market, it represented a true revolution in the surgical treatment of the scoliosis. For the first time, for surgeons and for the patients. For surgeons, because we had to get used to new concepts like the 3-dimension, how to correct in the not only in the coronal plane but also to restore the sagittal plane. And the surgery, we were used to perform easier surgery because the Harrington in the end was you had to put a hook above or one hook below and the rod in between. And when at the time when you had to use the CD, you had to put 2 rods and too many hooks, and so surgery become much more difficult and much longer than we were used to. Right? And that's the reason why this instrumentation was good for young surgeons and not that good for the senior surgeons because they didn't have enough patience just to spend in the OR trying to put all these hooks, and that's the reason why some of them quit doing this type of surgeries. And this is for surgeons. For the patients, I think that it was a major change. For the first time, they were able just to stand up 3 days after the operation with no need for cuts or braces. I think that it represented a major change. With regard to the expectations, we believe that by doing this technique, we will be able just to restore the spine, the 3 planes. By restoring the sagittal plane, the patient will be much better with this instrumentation with regards to the pain or degeneration that previous instrumentations like a Harrington have shown us. So it wasn't like a happy world that many surgeons started doing this, and 30 years later, what I have to say is that the patients, they forgot the benefits of the immediately, the early post-op, they forgot it. They experienced the new goods, that it was no need for braces. And in the long term, they are having pain. They are doing well, but they are having pain. They are not happy with the prosthesis, many of them. So I think that what we expected at that time, I think that these goals have not been fulfilled.
Any other comment?
¿Está bien así?
Sí.
Yes, after Harrington and Harry Luque, the CT instrumentation was more stable, more rigid, and allowed to, as Paco said, don't use the brace postoperatively. The aesthetic on cosmesis was improved. The rod doesn't rupture or doesn't broken, because this instrumentation used 2 rods. For us, it was very improved for the doctor and for the patients.
Joan, you have been the one studying the most the outcomes of patients. Which is your impression? What was the great advantage, or what do we still have to improve for these patients treated with third generation instrumentations?
Well, analyzing the data now, we have almost 30 years after surgery. There is I think there's a major problem is pain, because almost only 20% of patients reported that pain is not a problem for them. More than 80% report that pain is a problem in their daily life. So I need to analyze these patients, and probably through some prediction analytics or something like this, we need to know in advance which patients would be candidate or would be at risk of having a high level of pain, because as far as we know, probably there is a cluster in the scoliotic population, a cluster about 30% of patients that has a peculiar pain behavior. So probably this patient should be identified before surgery and should receive some type of support to improve the results. But there's a long way to do in this area.
The origin of this society was a meeting that was held by the spine surgeons that at that time were doing scoliosis. So it was decided just to create a Spanish spine society where surgeons involved in these deformities could exchange their experience and so on. And it was in 1984, and it was a domestic meeting, and there were very few of us attending it. And during the next years, 1985, 86, was quite domestic. And as everything in life, things are getting better, and the major change was in the early 90s that we, at that time, the relationship with the industry got closer, and that's the reason why the meeting improved a lot. And since that time, I think that this society has been improving till now, that I think it is a very solid society with sound principles, and the meeting is attending by over 300 surgeons. I think that we are very proud of the evolution of this society.
Yeah, I think that here was a very peculiar society because it was a mix between experienced surgeons and young surgeons, as Ferran, for instance, or Luis Alvarez, Teresa Vaz, and a lot of young surgeons that had they are very interested in work and in modernize all this stuff. In fact, we came from almost zero. That is the beginnings of her. It was a friends meeting to what now is, that is very modern. I think there's a society with very sound principles and very sound and strict methods to select communications, and I think I'm very proud to be a past president of the society. Yeah.
I mean, I just want to add that when we started with the hair, our model, our mirror was SRS. We tried to duplicate SRS
To clone it.
very close.
So here there is another great element of the families. All my colleagues used to travel every single year to the SRS with the spouses. And here is Amparo, a good friend of mine as well, and she was traveling to the SRS every single year. So my question to you is, what did the SRS meeting and traveling with them to the SRS meant for you? Amparo.
I travel with Carlos and with our friends Paco, Sanchez Perez-Grueso and Pili, and we enjoy a lot SRS meetings because I met my leaders because of my profession, because I am rehabilitation doctor. And then I met Winter, Bradford, Asher, Steffi, and a lot of doctors who travel and work a lot with patients with spinal deformities. But also we enjoy a lot the meetings when we had dinner and we prepare our dresses and met other spouses and talk a lot with them.
Paco, traveling with them, what did it mean for you as well?
Just to be in good company. And they were very relaxed. At the time that we were attending the lectures and the presentations, we were confident that they were feeling good because they went out and they went shopping and having good time. So it was very relaxed for us. And it's, if you are traveling with your wife or with your friends and their spouses, and you are hanging out with all your friends, I think that it means that you are having a very good time. And this is what the SRS, this part of the SRS represented for us. Good time too.
Carlos, anything to be added?
Well, to be married with a colleague is something special. Much more, we work in the same hospital, and he takes care of patients of spina bifida, cerebral palsy, and many others. So he provides me patients, I do the surgery, and we can share the complications between, which is quite comfortable. Anyway, this is a special way of working, but anyway, I think it's rewarding at the end.
I remember being a young staff member of the spine unit, and you were leaving to the SRS, and I was leaving that with great envy, and you were coming with your suitcases full, with your batteries charged, and always having a good time. I remember the pictures you were showing me. Really, this was a big seed and stimulus for us to be part of the SRS. I think you were, honestly, all of you great mentors.
Seguías con
Later on, I came back to visit Art Steffi. I learned from Arthur all I know about low back and lumbar surgery. And then other reference would be Jean Dibouchet, for sure, because he has a 3D analysis of the spine, and it's a good reference for me.
So the SRS was, this is how I experienced that, a good point for networking. And as I experienced that, I perceived that you were clearly influenced by some of the SRS members. So I would like you to tell me who were the personalities that generated a higher impact in your professional lives that you met at SRS. Joan.
For me, no doubt two guys. First was Mark Usher. Unfortunately passed away for his scientific soundness and honesty. And second, obviously, Ogeneva Boachi. Boachi was a big leader, and he allowed me to participate in the focus experience that was no doubt a lifetime experience for me. Yeah.
During my professional career, I had the opportunity to meet many wonderful surgeons. But if I had to say three names, I think it's enough. The first one is Jean Dibouchet. The second one is Mark Usher, as Juan said. And the third one, Ogeneva Boachi, not only because of his professional skills, but also because of her attitude in life. I said what I would say these three names.
Enrique.
Well, John Moy, he was in our hospital, Red Cross Hospital in Madrid, and he was 2 days teaching us about the spine deformity. Second one was Jean Dibouchet. Third, Mark Usher. I spent 1 week in Kansas University Hospital learning isola instrumentation, and Dr. Ogeneva Boachi in Ghana. I have the opportunity to assist him in some surgeries in Accra Hospital, Corlew Hospital.
Carlos.
Well, in 1981, I received a very small grant from my mother that allowed me to spend 2 months in the US. So I spent 1 month in the Twin Cities Scoliosis Center with Dave Bradford, Bob Winter, John Longstein. No, John Longstein wasn't there that year, and others. And then I returned in '86. That year I met John Longstein, and Ogeneva Boachi was the fellow of the Twin Cities Scoliosis Center, the last month of the Twin Cities Scoliosis Center. Then I came back again later with No, ya está. Paramos.